I'm Dr. Kelly Robazza for Beaches Health Group here in Toronto. Today I'd like to discuss some of the common complaints that we see in our office, how we treat them, and some tips on giving you home care. Today we're going to talk about IT band or iliotibial band friction syndrome. If you're a runner, you may have had this happen to you. About 4 or 5 kilometers into a run, the patient or the runner will get a real sharp piercing pain in the side of the knee. The iliotibial band is a big broad ligament that basically stabilizes the outside of the leg from the hip just past the knee. It prevents lateral motion, but where it gets into trouble is when it gets adhered to the quadriceps, which is a big elastic band, as well as the hamstring, which is another big elastic. When that non-elastic ligament gets stuck to or adhered to the quadriceps or the hamstring, and that muscle wants to contract and expand, it's going to put a lot of stress at the outside lower part of the knee, and therefore the friction and inflammation and pain. What we want to do to treat this area is to fatigue some of the muscle tension in the quadriceps and the hamstring. In this case, we're using a small muscle stimulator to send electrical currents through the muscle, and it's like taking that muscle to the gym and fatiguing it. After we use the stim, we would apply some deep massage therapy, whether it's active release or a foam roller or rolling pin, to break up the adhesions and to restore the flexibility of that muscle. But most importantly is to move the muscle away from the IT band and allow those two tissues to move independently. Finally, for home care, what we've got Deepa doing is some foam rolling on the outside of her leg. This is a great way to self-massage and to keep adhesions from forming and preventing scar tissue, and ultimately this IT band problem from coming back in the future.